Hi guys, welcome back to my podcast. This is Arun Gala, where I interview interesting people. My podcast is called Grabbing Coffee with Arun, and today I'm honored actually to have Dr. Manish Wani. He's an ENT specialist, and I'm just going to ask him some basic questions because I know I have some doctors in my family, but I'm kind of always curious about what people do. So, Dr. Wani, thank you for doing this podcast. Are you there?
Can you hear me?
Yeah, I can.
Yeah.
Yeah, I can hear
Okay.
you now. Okay, now just to kind of tell my audience, what do you do as an ENT specialist? What does that mean?
Sure. Well, ENT, of course, stands for ear, nose, and throat. We're also known as otolaryngologists, and we're
Hmm.
also known as head and neck surgeons. My specialty treats all the conditions for the ears, the nose, and the throat. And we treat patients from, I say, cradle to grave. So I have newborns all the way up to octogenarians and beyond. And so some of the common things that we treat are things in kids, for example, chronic tonsillitis, chronic ear infections, um, speech problems, hearing problems. In adults, I treat sinusitis, sleep apnea, thyroids, parathyroids, salivary gland tumors, head and neck cancer. So it's a pretty wide array of diseases that we treat.
Well, it's interesting, right? It's got a fancy name. So, what about what are some basic problems that people have that come to you for a solution?
Sure. For adults, the most common uh, patients of mine usually have sinus issues. They're
Hmm.
chronically congested, they have recurrent sinus infections, they have bad allergies. And so for these patients, and of course, they've tried over the counter nose sprays, saline washes. They've been on antibiotic after antibiotic, antihistamine after antihistamine. So the way we typically help them, or the way I typically help them, first of all, is we get an assessment of their sinuses. And so usually I'll do a CAT scan, which is a detailed x-ray of their nose and the paranasal sinuses.
Hmm.
And a lot of times we'll find things like a deviated septum, we'll find polyps, we'll find obstruction into the sinuses, we'll find chronic inflammation in the sinuses. And if medical management has been unsuccessful and they've tried all this stuff, then that's where surgery comes into place. And so one of the more common surgeries that I do is called a septoplasty, where a deviated septum means that the cartilage that separates the nose into left and right is bent. And people ask me,
Hmm.
well, how do they get bent? And usually you're born with it. Now, trauma can do it too, but you're born with it. And when it's
Hmm.
bent, but when the septum is bent, then you're going to have turbulent airflow and you're going to have trouble breathing through the nose. So we go in through the nose. It does nothing to the outside of the nose, but I trim the cartilage and we put the septum back in the middle. If there's also sinus issues, then I'll do what's called endoscopic sinus surgery, where we
Hmm.
go into the natural openings of the sinuses, make them bigger, clean out the sinuses, but allow them to ventilate better. And it really improves their quality of life. They breathe better, they have less sinus headaches, they have less sinus infections. So that's one of the more common surgeries that I do.
What about like snoring? Do you deal with that too, or is that something
Yeah,
that you
for
look at? Or
Of course, yeah. So, in when you say snoring, let's take for example in kids, because I do
Mhm.
have pediatric patients that come in, and the parents are like, he snores like an adult, keeps the mouth open all the time, um, uh, poor quality of sleep. And in kids, the most common reason is because they have their tonsils and their adenoids are too big.
Mhm.
And it's blocking the airway. So for them, the simple solution is to remove the tonsils and the adenoids, which do nothing for them anyways. But once we do that, they sleep so much better. Their behavior gets so much better. Bedwetting is something that gets better from this, and so that's instant results with that. Now, in adults, snoring can lead to what's called sleep apnea.
Mm-hmm.
where the patient actually stops breathing at night multiple times an hour. And what's happening is that the airway is getting obstructed. And so we do the diagnosis for this. I'll use what's called a laryngoscope, which is a sort of a light that we put into the nose and into the throat and can assess the anatomy. We'll do order like a sleep study, and nowadays you can do these sleep studies at home. We call them home sleep study tests. And if they truly have sleep apnea, then the treatment, the gold standard in treatment for sleep apnea is a CPAP machine. And this is called a CPAP, continuous positive airway pressure. So it's a
Mm-hmm.
machine that blows air into the nose and throat at night and keeps it open so the throat doesn't close. Now, it sounds uncomfortable, but I tell you, people love it. The ones that are successful in using it, they sleep much better. Their quality of life is much improved. Their energy level is much improved. But there are people that cannot CPAP machine and they can't tolerate it, whether they're claustrophobic or they have other issues. Yeah. And so then we do surgery for sleep apnea. And that could include a deviated septum, fixing that. It can include taking out big tonsils. The latest and greatest in sleep apnea surgery is something called hypoglossal nerve stimulation.
Mm-hmm.
And we actually put this implant into the chest that connects to a nerve that every time the airway closes, the nerve gets stimulated and it actually opens up the airway. So
Wow.
people have probably heard of something called Inspire or Genio, but that's our latest and greatest in treating sleep apnea from a surgical standpoint.
Let me ask you this, Dr. Wani. Like, my dad passed away last year because he had vocal cord paralysis. I had no idea what that was, to be honest with you. Do you deal with
Mhm.
that also, or?
We do, and I'm sorry to hear about your dad, but this is something what happens with the vocal cord paralysis. And usually, we have two vocal cords, a right side and a left side.
Mm,
And when the one of the vocal cords gets paralyzed, the first thing that happens is the voice becomes hoarse.
right.
Um, and recently I had a patient who came in because of hoarseness, had a vocal cord paralysis, and otherwise everything looked good in the larynx.
Mhm.
So then the workup is to actually get a CAT scan of their neck and their chest, because the nerve that goes to the vocal cord runs through the neck into the chest and then it comes back to the vocal cord. But
Mhm.
long story short, this patient ended up having metastatic lung cancer. And one of the nodules was compressing the nerve, and that's why the vocal cord got paralyzed. But they didn't have a cough, they didn't have any other symptoms, but they had cancer in their lungs, and that's how we diagnosed it. And of course, now they're undergoing treatment with radiation and chemotherapy and trying to treat the cancer. So
Yeah.
your dad, did they ever figure out why he had a vocal
No,
cord
he didn't.
paralysis?
They didn't. They couldn't come up with anything. Nothing at
No.
all. So.
And some people do have what's called idiopathic vocal cord paralysis, and we see this too, where the vocal cords get paralyzed and their workup is completely negative, and we can never figure out why that happened.
I mean, they did a tracheotomy for a while, and that's no fun either, right?
No. Well, in typically, if you have so if it's unilateral, then the airway is not so compromised. It's just hoarseness. But if you get bilateral vocal cord paralysis, and we've seen that, and it could be from surgery, it could be from trauma. Sometimes we don't know why it happens. Then it compromises the airway, and that's when a tracheostomy has to be done.
Yeah. So tell me a little bit more about the educational aspect. Like, let's say, for example, you go to medical school, and then what? How long does it take to do fellowship and all that?
Sure, sure. Well, of course, uh, usually to go to medical school, most people get a 4-year undergraduate degree. But
Hmm.
there are, I mean, this is the normal pathway, and then medical school is 4 years, and
Hmm.
it's usually in your third year where you decide what you want to apply for in terms of a residency. So, what specialty do you want to do? Internal medicine, surgery, radiology, OB-GYN. I mean, there's so many different types. So for ENT, back when I did it, which is 1994 is when I started, it was a 6-year residency program.
Hmm.
And so I did a 6-year residency program at University of Tennessee. Then my interest was in head and neck cancer. And so I did a 1-year fellowship at Rush Presbyterian in Chicago.
Hmm.
So my training was around 7 years. And then I came to Houston in 2001 and have been in private practice since then.
Wow. So you did 4 years of medical school, and then after that you did 6 years of
Residency.
oh my God,
Yeah.
it's a
And
lot of
then one
training.
year of fellowship. So,
So
yeah.
where are you now currently? Where are you working?
Yeah, so I'm with a group called Texas ENT Specialists.
Hmm.
My office is in Katy at the Methodist Hospital there. It's 18400 Katy Freeway. But I'm in a group of about 37 ENT doctors. So we're what's called a single specialty group, which is physician owned. So it's private practice per se. We have 15 different offices around the Houston Metroplex, but I practice at the one out in Katy.
But does somebody has to refer you to you, or I mean, we start off with the primary care physician, right? Then we get
I
referred to you, I
mean,
guess.
most people do, but it depends on the insurance. Like, it depends on your insurance plan. Some people can dial up a specialist and see them without going through their primary care doctor. So it really just depends on the insurance. And now if you need a referral, and you'll know that based on your insurance, whatnot, then you have to go through your primary care doctor. But
But
most
I
people,
go to I go to Kelsey Care, so.
yeah, you probably do need to have a referral from your primary care doctor.
But I don't. It's a good thing I'm in my 60s and I don't have any I don't have any problems yet. So we'll see what
Yeah,
happens.
good for you.
But I do have a
You've lived
snoring
a healthy
issue.
life.
Well, I do have a snoring issue. I think my mom wants me to get that checked out. So
Well, in what you need to do is see an ENT doctor and get evaluated, and really get a sleep study done because, sleep apnea. And a lot of patients don't realize that they have it, but it does put a lot of stress on your heart, a lot of stress on your lungs. It can cause arrhythmias, and so when you're young, and 60, I would still say is young, you kind of compensate for it, but over time, it does give you issues.
what about like exercise pretty regularly? I do the stairmaster. I do the elliptical. I'm a runner. I've done several marathons and all that. So
No, that's great. I mean, the thing, I mean, and it sounds like you're in great physical shape, but again, it has to do with the anatomy of your throat, the base of tongue, the palate, the hypopharynx. And, if that is constricted, then you'll be at a high risk for sleep apnea. And you just have to get that checked out. I mean, in snoring, so snoring is a symptom of sleep apnea, but as I say, not everyone that snores has sleep apnea, but typically everyone that has sleep apnea does snore. But if you do snore, then you should get a sleep study done.
yeah, one last question I have for you is, do we need more ENT doctors in the United States, or what is your opinion on that?
Well, I think, and that's a great question. And I think this is probably true for all specialties. I mean, in the urban city areas, Houston has plenty of ENT doctors. I mean, I think the number is like close to 300 now. But the people that don't have access are the ones in the rural areas. And they're that you're just not going to find an ENT doctor in rural areas. But in Houston, I think that there's, I mean, I think most people are busy, but I don't think there's a deficiency in ENT doctors in the Houston metropolitan area.
Yeah, it's a very interesting field, looks like. One last question I got for you is, what are some of your challenges with your patients that you run across on a daily basis?
Yeah. I mean, the challenges are, I do see a lot of patients who, um, y- they, the challenges to me, like, is if, if there's something wrong with their ear, nose, and throat, we should be able to find it with our exam, with our testing.
Hmm.
The challenges come when patients, for example, I have patients who come in and they're coughing all the time or they're clearing their throat all the time.
Hmm.
And everything is normal. And so those are the challenges. Like, why are they still doing this? And um, a neurologic tic? Is it anxiety? Is it habitual? And so when you don't see a pathology, but there's a symptom and you can't explain it, that becomes a challenge.
Hmm. That's interesting because, I didn't realize anxiety causes a lot of problems too. Because after my dad passed away, I had a lot of anxiety.
Well, it brings out a lot of, I mean, stress and anxiety bring out a lot of sort of physical symptoms in the body. And yeah, and so, and in these patients, it does take more time to explain to them. And again, we spend a lot of time and effort trying to find something wrong, but we don't necessarily, you're not going to find it in a lab. You're not going to find it on an x-ray. You're not going to find it on a CAT scan, you know?
So, Dr. Wani, one last thing is like, let's say, for example, that I mean, like a common person like me, right? I did accounting and all that. When do I know that, okay, I need to go see an ENT specialist? What would be
Yeah.
like a sign or something?
Well, a couple of things, if you have hoarseness, you have trouble swallowing,
Hmm.
you have pain in the throat, of
Hmm.
course, pain anywhere in the neck or the ear, if you get recurrent headaches, if you're chronically congested, if your allergies are out of control, your hearing goes out, you're not hearing as well as you used to. Um, if you have some sort of palpable mass in your neck, where your thyroid is, where the salivary
Hmm.
glands are, I mean, those are all reasons to come see an ENT doctor.
That's scary, right?
It can be, yeah, yeah.
Yeah,
But like anything else, the earlier you treat things, the better, the easier it is for us to treat.
you're right. Anyway, if you guys want to reach me, my email is arun, arun.gaalla@gmail.com. Dr. Wani, thank you very much for your time and thank you for the information.
Thank you, Arun. All right, we'll catch up soon.
Okay, bye.
Okay, bye.